What is PCA? PCA stands for Patient Controlled Analgesia. PCA is a way of delivering pain medication. Your team will decide if this is a good way to control your pain. PCA is used for patients who can understand how to use the pump to control their pain. Patients who are able to use the pump are at least 5 to 6 years of age. The PCA is a machine attached to your current IV and will deliver medication through this route until you can take medication by mouth. This means you are in charge of your pain button because you are the one in pain. The docs, nurses, or your parents cannot push the button for you, but they can remind you to push it before you try to do a painful activity such as turning, coughing, or standing. PCA can deliver medication in 2 ways, with an infusion and without an infusion. Your team decides which is best for you. With an infusion, small amounts of medication are delivered every hour, and you can give yourself extra medicine on demand as you need it. Most times the PCA is on demand only, which means you will control the pain by pushing the button, which then releases the medication as you need it. You will know that a dose is ready when the green light on the handheld device is flashing. The pain medication is usually Dilaudid or morphine, which are medications that control pain. Once you press the button, the machine releases medication in a dose that is based upon your weight. After you push the button and the dose is delivered, there is a delay or lockout time, generally 6 to 8 minutes, where no more medication can be delivered for safety reasons. During the lockout, the green light does not flash until a new dose is ready at the end of the lockout period. You can only receive a certain amount of medication in an hour, which is programmed into the pump, again for safety. Your team will ask you about your pain. They will ask you to describe the location of the pain, the quality, either burning or stabbing, and the frequency, constant or intermittent. They will also ask you to rate your pain using a pain scale. For younger patients, we use a FACES pain scale. For adolescents, we use the numbers scale to measure pain. Both scales start with 0, which is no pain, and 10, which is the worst pain you can imagine. We encourage you to use your button when your pain score reaches 4 out of 10 or higher while you are resting, and 1 to 2 minutes before movements such as standing, walking, or coughing, as these are usually more painful. You will be attached to a monitor and observed by the nurses while you are in bed or asleep. While you are on the PCA, you will be followed by the pain service. All of your doctors and nurses will monitor for side effects. Side effects can occur with any medication. With pain medications, we will monitor for breathing changes, itchiness, nausea, difficulty passing urine, or stool. If these side effects happen, do not be alarmed. We can adjust your current pain medications or add other medications to treat the side effects. We can even change the pain medicine if we need to. Once you can take oral fluids such as juice or eat a small meal, we will change your pain medicine from your IV to medications by mouth. This change to medicine by mouth is the first step to start you on your way home. If we know what works in hospital, we can continue this plan at home. The pain service and the nurses and doctors on your unit are available 24/7 to answer any of your questions. Being in charge of your pain control allows you to participate in your care and in your recovery.